Secretary General of the Kenya National Union of Nurses, Seth Panyako, has disowned the agreement that was signed by a section of officials of his organization and the Ministry of Health. Panyako says the three officials who supposedly represented the union at the signing ceremony are not signatories of the union.
We cannot take a decision in Nairobi and then the National Governing Council comes and disowns that decision. The National Governing Council represents the exact position of members on the ground. I want to say categorically that Mr. Maurice Opetu, John B. and Ali Soreng have no any legal nexus or mandate to sign any document. In fact, the return to work formula is only going to be signed by an authorized representative of the union, and that is the General Secretary.
All right, so what was that agreement? Remember, we reported that live this afternoon when it was signed at about 1 o'clock. But let's take a look at the highlights of that agreement that has been signed today. This is something that we will do a little bit later, so let's just get the right one there. And this is about the nurses' return to work formula. We will get the right Super Bowl for you now. But just to remind you that that agreement was signed this afternoon. Seth Panyako, who's the Secretary General, was conspicuously absent, but it was signed by the Chair, John B., as well as the Deputy Secretary General, Maurice Odhiambo. And we will get to some of the findings of that. Here we go. Now, this is what we're talking about. Now, the nurses have suspended their strike effective immediately, and they agreed that there would be no victimization and no disciplinary action taken against those members who took part in the strike that started on the 5th. Now, this is what was agreed this afternoon, that the recognition agreement between the county governments and the Nurses Union of Kenya will be signed on the 14th of December. That's on Wednesday at the Council of Governors headquarters here in Nairobi. Now, it went on because, remember, the other disagreement was on the CBA, which is yet to be signed. This one referring to the doctors. But now the agreement also says that that collective bargaining agreement for the year 2017 to 2021 will be signed in January 2017 and not later than March of the same year. They will also be getting a quantum increase in their allowances. Job groups G to L will receive 20,000 shillings increase. Job group M and above will receive 15,000 shillings. This amount of money will be paid in 2 tranches in a ratio of 60 and 40%. Now, 60% of these allowances will be paid in January 2017. That's the first tranche. And the second tranche of 40% will be paid on the 1st of July 2017. This is the agreement that was signed today, and this will be ratified by the National Governing Council of the National Union of Nurses tomorrow. It remains to be seen whether Seth Panyako will be present and whether this is binding to all nurses. The agreement with the doctors is still out in the woods, but we will be speaking to Governor James Ongwae, who's in charge of matters to do with workers at the Council of Governors. He will be speaking to us on this issue. He has been central to the negotiations that have been taking place. So which way forward? And what is that lasting solution to make sure that doctors never go on strike again, or nurses for that matter? Remember, this strike coinciding with that accident in Naivasha, it could have been worse, with hundreds more needing services at the various health centers within the country. Governor James Ongwae is my guest on Checkpoint a little later on.